We're very lucky to have with us live in the studios this morning Sharon Lerner. Sharon Lerner is a journalist who has covered a wide range of issues of concern to women for more than a decade. She has worked as a reporter for The Village Voice, where she wrote 2 regular columns and covered women's issues and health. Her written work has appeared in the New York Times Magazine, the American Prospect, The Nation, Ms., Salon.com, and Slate.com, among other publications. And she is here to talk about her new book, The War on Moms, on Life in a Family-Unfriendly Nation. So start out and tell us, what was your motivation in writing your book, The War on Moms?
Okay, well, I first got a call about writing a book when I was 8.5 months pregnant, and I already had that issue on my mind, obviously for personal reasons. I had written about women's issues, as you say, for about a decade before that. So I had been circling around a lot of the issues that I cover in the book for quite some time. When I started to get serious about it, though, and tried to think both personally and in terms of, what is worthy of saying in a new way and in a book length way about motherhood in this country, I started doing some research, more than I had already done, and I started looking internationally. And what I found really freaked me out, again, personally and professionally. What I noticed was that American women are in a very strange position, and I'll explain in 3 ways. First off, we work a lot. We have some of the highest rates of full-time employment in the world, almost the very highest. At the same time, we have a lot of kids. Actually, our fertility rate is 2.1, which you think, okay, that's not so high. But compared to other countries that are rich in the way that we are, other rich nations, it's really high. More than 90 countries have had their fertility fall below replacement level in the past couple of decades as women have joined the workforce. So we're working a lot and lots of hours, and we're having lots of kids. And what made this all really strange was that we're doing all these things without the supports that exist in most other countries. And by that I mean without paid family leave, paid maternity leave, paid vacation time, paid sick leave, flexible work options, and any significant investment, public investment in childcare, all the kinds of things that exist to various degrees in other countries, but don't exist here, in the kinds of things that would make it possible to easily or more easily work full-time and have kids. So the more I read, the more perplexed I got. And I figured the question to ask goes along the lines of what people tend to say about these sort of super moms that we hear about sometimes, people who pull it all off miraculously, and everybody says, well, how does she do it? And I figured I wanted to ask, how do we do it as a country? How is this possible? So, part of the answer, is really measurable. And as a journalist, I said about, finding the data to figure out how we do this. And you find amazing things that I pull together and feel help explain how we do this. Partly things like we have very high depression rates, right? I think that's connected. When you look at time use studies, women have mothers have very little leisure time. American mothers don't sleep very much. Single and or married moms both sleep about 6 hours a night on average, according to the National Sleep Foundation. The other thing that sort of fits right in with all this is that we have really high rates of poverty among women and children. So anyway, that's part of it. There are a whole bunch of numbers, but the other part of it isn't quite so easily quantified, and that's, what is it like to live and care for people under these conditions? And that's the other part of the book is the stories of people who are trying to take care of other people while they stay afloat, and what it's like when you don't have the support you need.
All right, so maybe you can give us some history of how we got here. Has it always been this bad here in the U.S.?
Well, I mean, we do have a long history. You have to realize that we now have about 70% of women in the workforce, and we got a majority somewhere around 1980. So part of the problem stems from the fact that we now have so many women in the workforce, and we have policies that are, or really in many cases, a lack of policies that came to be when most women weren't in the workforce, right? So we have a lot of policies built on the assumption that there's someone home to take care of people if they need taking care of. You know, whether it's an elderly relative or children, you know, there's this assumption that if someone gets sick or needs caretaking, that, you know, well, then at least you have one income for a family to live on. That's not true in a bunch of ways. Now, of course, we don't necessarily have two-parent families. Many more women are on their own, but also the economy has changed such that it's really not possible to support many families on one salary. And of course, then we have the economy, which means increased unemployment too. Still, a lot in a lot of the world, the policies that I'm talking about that would make life much more livable for so many women and men too, right now came into place way before, you know, that 1980 point that I'm talking about. And we did have some really exciting pushes toward things like paid maternity leave and real good childcare in this system. Of course, none of them ended up panning out, but you look back to 1971, and we had this really exciting moment when both the House and the Senate passed this Comprehensive Child Care Act, and we were going to put all this money into child care and have like a sliding scale system that would serve most everybody who needed it. And it had public support, and again, the support of Congress as well. It was vetoed by President Nixon in 1971. And part of the reasoning, he gave a speech that was written by Pat Buchanan that explained that, used the term, it wasn't socialism exactly, but I think he referred to the collective approach to child rearing. That's what it brought it down. But, you know, you can go back a lot farther. In terms of maternity leave, the awesome push to get paid maternity leave that I was talking about took place in 1919. And at that point, several other countries already had it. And there was an international labor treaty that 33 other countries did sign on to. We did not, but we came close. And it's sort of amazing to realize that. When I was researching this, it was really heartbreaking to hear these earnest, fights over paid leave, and there was a woman named Julia Lathrop who was scolding the country for being so out of step with the rest of the world for not having paid leave. And then there were other people who were saying, oh, but, we want this, but we have to make sure that it's part of a national health plan because we want to make sure that we have health coverage for everybody. So let's make sure we do it the right way. And they seem to think this was all around the corner, and this was 90 years ago, so it's sort of heartbreaking.
So give us a sense for what other countries do, let's say, with paid leave. Do you currently have paid leave? Because I think people who are unfamiliar with this might think, wow, the socialist countries over there in Europe. Right.
And it's true, the socialist countries have paid leave, but guess what? So does pretty much every other country in the world. There are, I think, 4 or 5 countries without it now. And by that, I mean every industrialized nation and most poor nations, again, save a tiny handful. So how much paid leave they get varies from country to country, of course. And you can look at some, the giants in this area are the Scandinavian countries. People talk a lot about Sweden because they have 18 months paid leave after the birth of a child. That's partially paid. It's still paid. After that, and in addition to that, men have a separate month of quote unquote use it or lose it leave, meaning that they have to take it. So it's an effort on the part of the government to encourage men to participate in child rearing. So let's say you're the man and the couple takes that, then you're up to 19 months, and then parents can take up to 8 when the child is 8 to work part-time and have job protection. So, okay, that's one extreme. There's a huge, a vast world between us and them, of course. But remember that this is poor countries too. So, for example, the small drought-plagued African nation of Djibouti has 14 weeks paid.
And then how about, let's say, the United Kingdom? What do they have there?
You know, I don't know the number of days offhand. It is substantially more than we have. And what's interesting is that many other countries, they frame it in a couple of ways. It's paid parental leave right after the birth of a child, and then there's parenting leave often too, which is separate. And then again, there's the issue which I mentioned with Sweden of having job protected flexibility and part-time options after the birth of a child.
All right. And do you happen to know for China? Does China participate in this as well?
Yeah, but those countries all do have paid leave. I don't have the exact number on hand.
Okay. Would 90 sound about right?
For which country?
China.
Yeah, that sounds about right.
Okay. So our leading competitor now, China, and owner of significant portions of the United States.
Yeah, and really, I mean, really, it makes more sense to talk about the countries that don't have it than the countries that do. You know, it's Lesotho, and they're really, I believe it's 4 or 5 countries.
So here in the U.S. is not paid, but people do get leave.
Yeah, let's talk about that. Yeah, okay. We have the Family Medical Leave Act. That's the law of the land at this point, which was passed in '93 under Clinton. And that says that employees should have 12 weeks off after the birth or adoption of a child and for a family medical emergency. The problem with this is that it only applies to about half of the private sector workforce. And people aren't covered if they, depending on how long they've worked for a company, how many employees the company has, what their hours are. So there are a whole bunch of reasons that it might not apply to you. But the other problem with it, and maybe the bigger problem with it, is that it's unpaid. So millions of people whom this applies to can't afford to take it or can't afford to take the whole thing. So as a result, you have most working women in this country going back to work before those 12 weeks are up. And some of them go back to work a few weeks or even days sometimes after giving birth. And I talked to some of these women and wrote their stories in my book. And these are people who are sometimes haven't recovered from the experience of giving birth. These are sometimes people who don't have any decent place to send their children when they have to go back to work. And so we're talking about newborns, right? I mean, they're less than 12 weeks old. Sometimes they're 2 weeks old. Sometimes they're 3 weeks old. And I just think that it's not what anyone in this country thinks of as valuing families or family values. And I do think that this is a political issue that that folks on both sides of the aisle could unite around. You know, if you hold up a little 5-week baby and say, okay, folks, who of you thinks this baby should be separated, it shouldn't have a parent around for for these first few days of its life or weeks of its life? I don't know who's going to raise their hand, you know?
So as appalling as that information is, you could almost accept it if there were a system of a valid childcare system here in the U.S., but that doesn't exist either. Can you talk a bit about that? Sure.
Yeah, we have, you nailed it with it, we don't really have a childcare system. What we do have is some federal money for low-income families who can't afford childcare on their own. And that is a good thing. However, that system only covers about 1 in 7 families that needs it, which is to say the rest of them can't get it because we haven't fully funded the system. So what you have around the country is these really long waiting lists of people who qualify for child care assistance because their incomes are low enough, and they still can't get it. And when I say low, it varies state to state, but sometimes it's like, a family of 3 has to be making less than $20,000 or something like that. It's low, it can be very low. So what does it mean then when you have thousands and thousands and thousands of kids in families who can't afford childcare? Well, it was a question that I figured was worth exploring. What happens to these kids? So I went to Florida, which is a state with a pretty long waiting list, and I contacted one of the service groups that actually holds the waiting list for child care subsidies, and they helped me reach a bunch of the families who were waiting. And it was very upsetting to spend time with them and see what was going on in their families. I mean, sometimes they were taking their kids to work with them, and that wasn't working out very well in the cases that I saw. Sometimes they were leaving with their kids with anyone they could find. And and sometimes you have a great friend or relative, and you find all these wonderful people who are willing to give of themselves and help you out, and sometimes you don't. So, and then people are also putting their children in very underfunded child care centers, and I can tell you that when you don't pay for decent care, the care is not decent. So in Florida, where I was, child care workers are making minimum wage. So if you can make more flipping burgers or stocking the shelves somewhere, you're probably going to do it. And that means that they don't have a lot of child care workers to choose from. They don't have a lot of backup in terms of if someone gets sick. So, I went to one center where the ratios, and the ratios in the state of Florida are pretty extreme to begin with in terms of how many adults can be, or how many children can be with a single adult. But one of the centers I went to, the director freely admitted to me that she and one other adult had been with 38 toddlers that morning, 38. And she told me, she described how terrifying it was to be responsible, because nobody can look, after so many young children. And she said her heart was beating so quickly that she had to, that it took a really long time to calm down afterwards because she was terrified that someone could get hurt. And of course, luckily they didn't, but it could have gone another way, and it frequently does. And the reason is that we don't spend enough on it. And we also, part of it is also spending money to oversee quality in a national way, which we don't.
It's like numbers that would generally alarm people, a ratio if that was the number of kids in a classroom,
right?
Let alone a childcare situation. Talk a little bit about flex time and our lack of it here in the U.S.
Yeah, we don't have a lot of flexible work options, and one of the ways that you see this is in our very high rates of full-time employment that I was talking about before among women. And it's interesting, there was a Pew survey that came out a couple years ago that asked these full-time working mothers if they wanted to be working full-time, and 60% of them said that they would prefer part-time work, but it wasn't out there. Another part of that problem is that health care and health coverage in our country is often tied to full-time employment. So a lot of people are working because partly they need the income sometimes, and partly they need the health coverage for their families. So without the decent part-time work options, you have women either working a lot more than they'd like or often not at all, right? Which contributes to the poverty rates. I've been talking about poverty rates of women and children. Other countries, again, do it differently. The European Union has laws that require parity in terms of pay and benefits. And remember, their health care isn't tied to working full-time, so we're not talking about health care. Everybody's covered, right? So you take that out of the picture, but still, all the other benefits that you can get from full-time employment, you get as a part-time employee, and also you're not allowed to be paid less simply because you work part-time. But a lot of countries have gone farther than that, including the Netherlands. And I went there to sort of investigate what it looked like to do what they've done. And what they've done is they've said basically, if you want to work part-time, in most cases you can. Very few exceptions. You have a job, you request part-time hours, and your employer is pretty much obligated to grant you them. You don't have to be a parent, you don't have to be a woman. It just works that way. But as a result, the parents of young children Dutch parents often do work part-time. 75% of Dutch working women work part-time, and almost a quarter of working men. And what that means is that there are a number of couples in which both parents work part-time. And I went and talked to them about what that's like and watched them, and it seemed decidedly saner than what I've witnessed and experienced here. So and of course, we don't have any of those regulations in place.
So how do you respond to the people that say, well, it sounds like you're looking for a national federal solution to this, that say that, you want a socialism or to bring us a literal nanny state.
Right. No, the nanny state. I've heard that. Well, let's go back to paid family leave. If that is socialism, well, then the rest of the world is socialist. Because, again, that is something that only a tiny handful of countries, everyone but a tiny handful of countries has already done, right? And, of course, these are not all socialist governments. They have a variety of political and economic systems at work, right? So it's not about being socialist. It's about, I think, being humane. When you look at childcare, it's a matter of putting the money in. It's not, we already put some money in, right? I was describing our extremely underfunded system, but we have a system for very low-income families. I think it's recognizing that the world, our economy has changed such that affording childcare is not just a problem for very low-income families. The reality is it's a problem for the vast majority of American families at this point. So I don't think it's about changing the system at all. And you know what's interesting? I mean, I have heard these things about, well, you're asking for a nanny state, but when you look at the numbers, and there's a great Rockefeller Foundation study that just came out that showed high political support, and I'm not going to remember the exact numbers. They're in the 60s and 70s for paid family leave among evangelical Christians and conservatives. And I do think this is an issue, as I said before, that can cross the aisle. I mean, think about it. It's, if you could argue in the 80s, as Reagan did, that family values had to do with cutting services for families somehow, if you could sort of make that argument then, you just can't make it anymore. And if the right wants to hang on to the mantle of being a family values party, I think this is what they have to do.
Has the recent health care program, is that anticipated to alleviate any of these problems? Yeah,
it will. One of the really ugly things that's going on now in terms of health care is that mothers are less likely to be insured, and partly that's because they are discriminated against on the basis of gender. They things like having had a C-section is considered a pre-existing condition, and possibly the ugliest part of it is that being pregnant is considered a pre-existing condition. In the individual market, if you're pregnant, you can't get insurance because you're pregnant, you need insurance. So it's very ugly. And I write about some of the really sleazy companies that have like sprung up to prey on women who are pregnant and need insurance. And you laugh, but they're bogus health insurance companies that are marketing themselves to pregnant women. So these things aren't going to happen, they'll be put out of business by the new healthcare law, which that's exciting. That's a step.
So are there any examples of either in companies or states that are doing positive work on this right now that might be a model?
Yeah, it's actually really exciting because there's some family leave programs happening on the state level. Washington being one, Washington State, New Jersey. There is some paid sick leave legislation trickling up also around the country. And Obama, in the new budget, which hasn't been voted on yet, put some seed money for more state family leave programs to happen. I think ultimately this has to happen on a federal level, but if you look at how such things have happened in the past, it tends to trickle up from the states. So I do think we're seeing some movement, and I think that's exciting.
We still have a couple minutes left. Final thoughts you would like to leave with listeners?
Yeah, I guess one of the things I noticed as I traveled the country talking to people is that they felt terrible for not being able to do as good a job as they wanted, taking care of their families, and working and sort of balancing it all. And I think there is a lot of guilt and self-blame out there. And I think that I think there are a lot of folks willing to heap blame on families for not doing as good jobs as everybody thinks they should. But I guess that what I'm trying to convey and what I feel so strongly, especially having talked to so many people about this, is that it is much, much more than an individual problem. And I think most of the people I spoke with could not have been working any harder. I think that the way to deal with this is to see it as an external problem that has to be fixed this way. It's a policy problem. It's a policy failing and not a personal failing. So I feel like the more we understand it, the closer we will be towards solving it on a national level.
All right. And in addition to your book, do you have a website that people can turn to?
Yeah, it's SharonLerner.com, and I have events and reviews and whatnot there.
Very good. Well, with that, we're unfortunately out of time. I want to thank you very much for coming in and spending time with us this morning.
Thanks so much for having me.